All emergencies or disasters happen at the local level and expand from there. What do hospitals do? What do care providers do? What do EMS providers and clinic providers do when there's a local emergency or event? They mobilize resources, they mobilize personnel to respond to that event that is occurring. Local responders may need additional resources in order to manage an effective response. The Standardized Emergency Management System, also known as SEMS, is the tool that the state of California utilizes to obtain mutual aid and provide those resources to the locals. In some cases, the healthcare providers interact with their county or city emergency operations center. Their single point of contact at that emergency operations center is the medical and health coordinator. The local emergency operations center has access to mutual aid resources throughout the state and indeed the federal government to ensure that the local people responding to the event or disaster have enough resources to meet that need.
If an emergency occurred that was so large that it required federal resources, this would bring to the table the Federal Emergency Management Administration, FEMA. FEMA is a federal agency that is designed primarily to deal with preparedness, mitigation, and response strategies to natural disasters. A component of FEMA that would be actively involved might be the National Disaster Medical System. Within this system is a network of teams called DMATs, Disaster Medical Assistance Teams. These teams can be mobilized within about 12 hours. They are comprised of medical personnel, nurses, techs, pharmacists, so that they can be a self-contained operational unit to provide resources for medical care in the event of a disaster. You would also have the activation of a couple of other federal resources. One would be the Department of Justice, because you would have the FBI involved. Another avenue of resource is what was called the National Pharmaceutical Stockpile. It's now called the Strategic National Stockpile. This is a large collection of antidotes, vaccines, antibiotics, and other materials that could be useful in responding to a biological, radiological, or a chemical attack. It's self-contained. It can be mobilized by air. There are preliminary push packages. These are collections of medications and antidotes that can be delivered within a matter of 8 hours to any place in the country where they're required.
Laboratories play an essential role in bioterrorism events. They're the source of information that helps the epidemiologist know what the disease is and possibly where the disease might be coming from. The CDC has organized laboratories across the country into 3 levels, with the hospital labs primarily doing surveillance work. The next level is the reference lab, and in California there are 2 reference labs, one in Los Angeles County and the state lab in Northern California. They are the second tier and would take anything that's suspicious from the hospital lab and do further testing. The confirmatory labs are the national labs, such as CDC or USAMRIID.